Well, it is Telehealth Awareness Week, and with telehealth becoming so common and so popular, we are taking a closer look at how it's improved and how effective it can be, especially when we're talking about mental health in the mental health space. Joining us here in studio is Krista Kane. She's the Executive Director for U of L's Health Telehealth program. Great to see you.
Thanks for having me.
And it is Telehealth Awareness Week, right?
It is.
It is. And
yeah.
I mean, just talk about like the growth and how popular. I think when telehealth first kind of emerged, I feel like people were very skeptical of it, of,
yes.
oh, I don't, how is that going to help me? But it's found its footing.
Absolutely.
Yeah.
Before 2020, what we've been doing in U of L Health and many other systems, we've been doing telehealth for years and years, but it's been really restricted to getting specialty services to rural areas. Mm-hmm. So it was kind of just in that container. And when we looked at the numbers, the last 3 months before 2020, so the end of 2019, we saw in our clinics here 15 telehealth appointments. That was it. And in the first quarter of 2020, we saw 21,000.
Oh, wow.
Like it exploded out of necessity.
Yeah.
And so there we were. Everyone was suddenly doing telehealth.
And it seems to really have taken hold when it comes to mental health.
Yes.
And getting either a mental health counseling or an initial assessment. Like, talk about how those two have really kind of worked so well hand in hand.
Absolutely.
And why that's such a great vehicle for mental health counseling appointments.
Of course. So since 2020, I think everyone has seen nationally that psychiatry, behavioral health therapy works amazingly well over telehealth, especially for adults and adolescents. And so what's great about it, I think, is that it removes a lot of obstacles that are in place. Either someone may not have a mental health provider that's near their home. They may not be mobile. They may have transportation issues, but also some people just want a lot of privacy around seeking help for mental health. And mental health care is health care.
Yeah.
And we're doing everything we possibly can to really just increase access, increase awareness, and make it easy. So if someone can sit on their sofa or in a quiet room at their office, or a lot of times in their car, and do some behavioral health or psychiatry services over telehealth, it really reduces a lot of barriers. It's a lot like just using FaceTime.
Yeah. Super easy, and two, it's like people, it's one thing to actually get an appointment. If you've been through this, sometimes the answer is we can get you in 6 months, and that's no joke, to a year. And you're thinking, I can't wait that long. Or your loved one, they can't wait. They got to get somebody. This is mental health. This is something behaviorally we need to talk about now. This, you're able to, with a lot of them, are you just able to like select your times and here's availability?
Yeah,
and you do it all on your computer, on your laptop? So
in U of L Health, really mental health issues have just exploded since the beginning of the pandemic. People have, been facing a lot of changes. And so having access has been an issue, and in our own community, a lot of times the wait times that you describe are really the ones that are real. And in our own system at U of L Health, our leadership looked at the problem and they were like, we got to do more of this. We got to do better. So we started the Peace Now Clinic, which is associated with Peace Hospital, and it is mostly telehealth clinic. And our guideline for that clinic is that we assess new patients within 2 weeks.
Wow.
So especially because some people, again, feel funny about seeking help.
The worst thing is walking into a doctor's office. Everybody knows me here. If you see a neighbor, or you see that's the last place you want people. You want to even talk to people, right?
It's so true.
Yeah.
So so we want to reach out to people at the time that they're feeling ready to look for help.
Yeah.
That's really the important time. Who knows what state of mind they might be in 3 or 6 months later. So what we do is any provider in the city, a school counselor, any kind of clinician, or a primary care doctor can refer to Peace Now, and we'll set up an initial assessment appointment. from, the privacy of their own home or wherever they feel comfortable.
Telehealth, mental health counseling, is that good for teenagers? Do you think that's an easier thing
It
to
is.
get them in?
Now that school is back in full swing in most counties, teenagers are changeable. They really can switch on a dime. And I would say to parents, if your child seems too worried, seems too sad or too sleepy, or you're worried about substance abuse, and you're just feeling like they're really not enjoying their full, healthy, happy life, I wouldn't wait. We do take insurance, so it's really easy, and you don't have to kind of drag them somewhere because they can sit on the sofa at home and do the assessment and be referred for services. And I just think it's a comfort for parents to be able to reach out like that and just do a check-in.
Absolutely. Well, Krista, great to meet you, and thank
So
you
nice
so
to
much.
meet
Such an
you.
important topic. If you'd like more information, just head over to uflhealth.org. We can kind of dial you through everything that they have to offer with those telehealth appointments as well. Well, coming up.